Hi, my name is Dr. Rudra and through the Oral Health channel, today we're going to talk about dental tourism in India. Now, I have created the Hindi counterpart of this, which was directed at the Indian audiences. Now, I'm going to be catering to international audiences right now. Dental tourism means basically when you're going for a vacation for dental needs purposes. It's as simple as that, because of the fact that in the West and in a lot of the European countries, the dental treatment is very expensive, and a lot of times you don't have insurance covering it, or you don't have insurance, or you don't have the services available under this insurance banner. So what happens, the treatment cost goes very high depending upon whatever the disease severity might be. But fortunately for you, for all the people who are residing outside of India, let me tell you something, we have very, very good quality dental treatment, great doctors, specialists, state-of-the-art machines, protocols, standardized operating procedures, international standards of sterilization protocols, and making sure that everything is hygienic, safe, and completely secure when it comes to catering to your dental health needs. So I have to be very honest, dental tourism is not something that is very new. In India, dental tourism is actually 10% constituting the medical tourism, of the whole of medical tourism. It contributes about 10%. It's very simple. That's how it works, because of the treatment costs being very markedly, different compared to the Western and the European Union compared to India. With the same materials and everything is very similar. It is always better for you if you are residing in the Western hemisphere, or if you're residing in the European Union or in the West. It is always better for you to come down to India, and thereby you can get your treatment done. Let me tell you what are the advantages. First of all, the quality of treatment is pretty good as long as you do your research, because there are a lot of hospitals, there are a lot of hubs, especially around Delhi, Chandigarh, Bangalore, places like Mumbai and all these places where dental tourism is practiced very, very much. On top of that, the doctors are very specialized. All of them know at least English very well, so that the communication barrier is not a problem. Secondly, the state-of-the-art procedures, protocols are taken care of. And the main thing is the cost, because if you compare India versus the US, the cost kind of ranges, in the US for dental treatment to about 6 to 7 or even 10 times compared to what we have in India. And the same materials, same procedures, same skill. There is no difference. On top of that, why it is called dental tourism? Because what you can do is, in terms of dental tourism, you can get something like a holiday package where the hospitals or maybe the clinics also have some tie-ups with some tourist agencies. So you can come here for a week or two or even more, and while you're getting your dental treatment done, you can go out for excursions. You can visit Incredible India, because we are a very vibrant country, and it comes to stuff like the tourist attraction spots a lot. So you can have a hospital or a dental clinic or treatment related vacation, so you don't feel bored. Now, the beauty about all these things is that a lot of insurance agencies don't cover a lot of procedures under dental treatment, and a lot of insurance policies don't even cover dental treatment. So that's something good for us, because we don't require it here. As of right now, we've not ventured much into dental insurance per se, and that's why for a lot less price you can get good quality treatment. In fact, even a very, very top-notch treatment, because I have worked with the US for dental insurance and I know it. So it's something that I am very proud of when I have seen the work of both the nations. Being an Indian, this is not my nationalist talking. The work is much better here for much lesser than the price. On top of that, reconstructive surgeries, dental implants, which cost a bomb in the US, right? It is much less, it is much more inexpensive here, and you can save that money to go for your other vacations. Secondly, what you need to really understand, that a lot of insurance related procedures which are covered under the insurance policy take a lot of turnaround time. That means you have to wait a lot for the approval to come, and then you can go ahead. Now, your mouth is a dynamic environment, and that's why you cannot wait, because the severity can go from worse to severe, and that would increase or incur extra costs that would lead to the intensification of the vicious cycle, that you need another approval for something bigger. So you don't have to wait for long here, and that's something really good. And finally, on top of that, let's talk about some of the risks as well, because I think that we need to be transparent while spreading information. Yes, there are some risks involved in dental tourism, because if you're coming from afar and you're getting some long-term treatment done, there's a high likely chance that you might or might not have some post-operative complications which might not be treated by your local dentist for whatever reasons. I'm not going to go into the political aspect about it. But then again, this is something that we do from our end. We have something known as a dental tourism liability waiver form, which we make. So we sit down with the patient party and we tell them that this is what it is. You can come back whenever you want as per your convenience, but we will not be able to offer anything. The max we can do is provide communication to your local dentist provider there and apprise them about what needs to be done, and if they're all right with it, they can go ahead with it. To sum it up, it's actually a very great thing. And I've already had a lot of patients who have flown down for treatment here, because the kind of costs that they tell, especially around stuff like periodontal surgeries and laser surgeries, it is humongous. I was shocked, and I was doing the same job, probably even sometimes better than what my foreign counterparts were doing, with much less when it comes to the power purchasing parity. And it is basically a function of your national gross domestic product. So obviously a lot of people might argue that they earn also in dollars, they earn also in pounds. That doesn't matter, because despite that they earn so much, despite all those things, still dental treatment is very expensive in the West. So I want to, if anyone's watching this from the West and they feel like they want to come to this beautiful country, India, to have a good dental experience, I would warmly welcome you with folded hands, and you can come here and get your dental treatment done for much less and the same quality, in fact even better quality, with qualified dentists and specialists, so that you can get your oral health back to normal and smile naturally as much as possible. So this was today's episode. Please like, share, subscribe, and do press the bell icon button for important updates. If you want to get in touch with me, here are my social media handles. Kindly refrain from calling me directly, as I might be busy with patients. Just drop me a message on WhatsApp with your name, your location, and the common oral health problem that's causing you discomfort. I'll get back to you in a couple of days and we can have a chat. If you have any queries, doubts, apprehensions, insights, or suggestions, please feel free to put them in the YouTube comment section. So that's it for today. Thank you.